Hi, I'm Dr. Ryan Smith, and today we're here to talk about diastasis recti. Let's take a look. It's a separation of what we call your rectus abdominis, or that six-pack that you have. And there's a line that goes right down the center of people. And when you are pregnant and then postpartum, it naturally needs to separate to allow you to be able to carry a child and give birth. It is a natural occurring process, right? The kicker is afterwards, when women are recovering, they have this separation and it becomes worrisome. One, because first and foremost, it's very aesthetically right there in front of their faces. And two, in general, a lot of women come in reporting sort of not feeling connected to their abdominal wall, or things in their abs feel difficult, or there's just not quite like a concrete, I feel stable in that position. And that's all completely normal. What we know now is that a lot of what goes on with what we actually see with the diastasis recti is not what actually is occurring in terms of pain or functionality for that person. So there's a big separation between that. What it looks like does not always translate to exactly how that woman is feeling, or if they have any sort of pain at all. So let's take a look at what it is though, so we can get a better understanding of how it goes. So when I'm kind of poking around on Mandy's stomach here, everything feels very loose, right? You can feel some of the muscles underneath, you can feel a whole lot of various things, but it's not like I'm pressing directly into similar feeling of like a quad muscle. So how I feel these things and where I look at the potential separation is have Mandy here do a small crunch up where she lifts her shoulder blades off the table. And what I do is I kind of poke around the ridges of her abs. So if I go right down the center of where her belly button is, and I kind of poke to the sides, I'll feel the ridges of her abs, or rectus abdominis, all the way. Now the space between is the linea alba, or what connects the abs, and in terms of postpartum and prenatal women or others who have diastasis recti, this is also where the separation would occur. And you can go ahead and relax. And what we do when we measure that is look at the finger widths of how separated those two spots are, or how separated those two ridges are. So it can be oftentimes 1 finger width, 2, 3, 4, etc. So now we're going to look at Megan's stomach as well, and kind of her six-pack, to show, one, the variance between multitudes of women, and also that we don't really have a great understanding of the separation of the abs before someone is pregnant or afterwards. So when we get all this data on what diastasis recti is and what we can do about it, the kicker is we don't really know a lot about what's going on beforehand. And it's good to see, I think, the wide variability and differences between people. So here's Megan. So same thing, when Megan's just laying here, we kind of can just feel around. Now when I have her do a small crunch up, and she lifts her head and shoulder blades off there, I kind of can go between the ridge of where that separation would be right here and feel the sides. Now for Megan compared to Mandy, Megan has a much clearer distinction of that it's very, very close and not as separated as Mandy's, right? Now these are both women who don't have any history of pregnancy or postpartum or anything, yet there's a difference between those two. Now she goes ahead and relaxes, I don't get to feel those ridges as much. So it just shows the variability between people, and that should give us caution to know that there is a high degree of variability afterwards, and we're starting to see that, right? So the diastasis recti, yes, is something we should look at, but more importantly, the connection of how you feel between your abs and when you're moving, not necessarily just the finger width or the distance between the abs themselves. If it becomes a certain distance, yes, there's other conversations to be had, but for the most part, for the majority of women, it is a naturally occurring phenomenon that happens during pregnancy and postpartum. And yes, aesthetically it'll be right in front of your face, but we know that we can help improve function and everything by simply working on strength training and getting you moving and making sure that you feel comfortable in your own body. So if you have diastasis recti or other women's health issues, please find a specialist in your area. If you're not here near Recharge, within your area you can find some physical therapists who specialize both internally or externally with both pelvic floor, pelvic health, and women's health work.